Hello, is it okay? Can you hear me? I need a comment to make sure that you can hear me. Okay, so I'm starting now. Hi, I hope you enjoyed your iftar today. Welcome you all to the third live session on MRCS. Well, basically, today's session is not on MRCS. Today's session is more like what do you expect when you come to work in UK as a junior doctor. So I'll just try to start from the beginning and go step by step, so it is easy for you to understand. Well, so this is the step when you have finished your PLAB or MRCS or MRCP, and now you have got your sponsorship certificate. Or so the thing is, when you first accept an offer for job in the hospital, they will provide you a certificate of sponsorship. So you will need that to apply for Tier 2 visa, which is a work visa in UK. So you will need basically four papers that are important. You will need your certificate of sponsorship, your passport, your TB clearance certificate, and your police clearance certificate. And then you can apply, and after you get your visa, so now it's time to move in. You have to book your flights, and there it's like a lot of paperwork. So you have to arrange all your financial documents and ID documents and academic certificates, experience certificates, whatever you have, because you don't know what you will need after coming here. So it's better not to leave any papers in Bangladesh. So you will have to arrange those papers in an organized way in your file, and then so whatever you need to do, some shopping, some basic things. So here the thing is, most of the flights don't allow you to bring more than 30 kilos or 40 kilos. So you have to be very choosy what you need to bring here or what you don't, cause most of the things, if you just buy your regular clothes and your papers and regular use stuffs, so it's already more than 40 kilo. So yeah, it's a bit of struggle there. So then you have booked your flights and it's time to move in. And so before you move in, you have to arrange your accommodation. So most of the times the hospital does not arrange any accommodation for non-trainee doctors. So some hospital does. It depends upon the trust. So if they don't arrange your accommodation, then you will have to fix if how are you going to come to your hospital or your living place from the airport. And then so you have to arrange your transport and you have to arrange your accommodation. Well, about the camera, so this is, I'm in a bit of difficult position, sorry about the camera. It's just I can't, because I have kept it on something, so I can't fix it. Sorry. So about your transport, you can arrange it by Uber. You can take an Uber, or you can, if you are coming through any agency, job agency, then they also sometimes arrange some transport for you from the airport. And there are several apps called Airbnb and other apps that you can arrange some temporary document like accommodation for you. So Airbnb is you have to pay per night. So it's for first 2 weeks you can arrange an Airbnb accommodation. You just it's like if you just take some normal room, it costs normally 20 to 30 pounds per night. I am sorry about this camera. I don't know what to do about this. Okay, I'll try to hold it for a while. So Airbnb is they cost you 20 to 30 pounds per night. So for first 1 or 2 weeks, maybe you can arrange that if you just go to Play Store and download an app Airbnb. So if you go there, they will sort out everything. So it's more convenient to take a single room with attached bathroom, and also furnished, and also with kitchen or breakfast. So all the, it depends upon your how like what is the time of the year, how busy are they. So it depends upon that, but I would say that arrange it at least 2 to 3 weeks before you come here. So sometimes if you do it just 4 or 5 days before, it's too busy that you can't find any suitable accommodation, and it has to be really near to your to GMC or to your hospital. When you come here for the first time, so you don't know the places, so it's better to stay as near as you can to the hospital or to GMC. So at first, for first 1 or 2 nights you have to stay in London, because if you have not done your ID check yet. So ID check is basically you need to take your papers to GMC, and it's like a face-to-face meeting. It's not interview or anything. They just see you, they just check your ID, they just see your papers, and they give you the GMC registration number. So after that, you will move. So sometimes you will move to your, like I came to London first. I stayed there for 2 days, and then from there I came to Bedford. So I came through a job agency, so they arranged transport and everything for me. So I didn't have to worry about that. But sometimes your hospital may also arrange the transportation. The one thing is, never hesitate to ask them, because if you don't ask, you will not get it. If you don't just assume that they will not do it. There's no harm asking. So you can ask your hospital, you can ask your agency that are they going to arrange any transport for you or not. So when you go to your city, you need another temporary accommodation if your hospital doesn't arrange something for you. So there also you can take Airbnb anywhere in. So for 2 weeks you can expect like 280 to 300 pounds. And then so when you come here and you go to your hospital, they do an occupational health check, which is basically a TB test and a small blood test, and it takes normally 1 week. So in this 1 week you have to get accustomed to the new place, to the new environment. So probably just go out, see the surrounding. So the thing is, now you need to fix a permanent accommodation for you. And you have to make a plan, because once you start your job, you will not get enough time to change your accommodation or anything. So it's better in that 1 week to arrange everything, that where are you gonna stay permanently for the 6 months or 1 year. So there they have different apps called Zoopla, Rightmove, Smart Move. This all these apps you can find in Play Store. So if you download the apps and if you go there, so you will find there are different kinds of accommodation. They have a single room, they have shared accommodation. You can get a single room in shared accommodation with attached toilet or not with attached toilet, it depends. And then you can find a studio apartments, which is basically just one bedroom and one common space, dining space. And you can so when you come here first, if you don't bring your family with you, if you are coming alone, so it's better to go for shared accommodation or studio flat. I mean, one bed apartment, two beds apartment, it's not worth it taking them, because like at first for 6 months it will, you will be mostly in your hospital, you will be just sorting out what to do and what not. So you will barely spend some time at home. So you just can go with as simple as you can. So after that, when you are well, sorry, today I'm really not talking about MRCS or PLAB or MRCP. Today's session is just on the lifestyle here, the struggles you have to face, and the like good and bad things you can expect from here, the work environments, and that's it. So today I'm not doing any academic discussions. So well, after that, when you went to your hospital, you've got your occupational health done, and then you go to um, find some permanent accommodation. So the permanent accommodations, if you get a single room or a studio apartment, it costs normally 400 to 500 pounds per month. So that way, and when you first move in, you have to pay 1 month of uh, like 1 month of rent in advance. So if you take 500, say if your accommodation is 500 pounds per month, then you will have to pay them maybe 1,000 pounds. So for here, if you try to do some calculation, when you came here, the flight tickets maybe 400 to 500 pounds, and then the transports, if they don't arrange, you have to take Uber. So for Uber, the problem is in UK, if you have to, like for using Uber, you need to have a card. So they don't pay in cash to drivers here. It's just you need to insert your card details, and when you call a car, they just directly cut the balance from your account. So if you don't have a credit card or Visa card in which is like usable in UK, then using Uber for the first week will be a bit difficult for you. Well, if you have an international credit card, you just can use it. That's not a problem. So after that, you need to arrange your permanent accommodation, and when you look for your accommodation, you have to make sure some things, it has to be furnished, because you can't buy your first accommodation, you are going to change after 6 months to 1 year anyway. You can't just buy all the furnitures and stuff and then move with all of them. So yeah, so they have to be furnished, and they have to be include the bills in the monthly rent. So you have to make sure that you don't have to pay any extra amounts at the end of the month. Well, after that, you have to you have to open a bank account in one of the UK banks, which is, they have HSBC, they have NatWest. So you will have to show your documents. So there, I mean, organizing your documents and taking care of them is really important. So here's the spoiler, I mean, remember the time, the important documents, the house rent, the food shopping was not your headache, it was your parents' headache. Welcome to adulthood, it's your headache now. There's no one to take care of these things anymore. You have to be very careful about your documents. You have to be like you have to take care of your own ID documents, your academic documents, your financial documents, your bank account, your accommodation papers. So when you fix a permanent accommodation, they give you some accommodation contract for 6 months or 1 year. So you have to be very cautious about them. You have to read your contracts very carefully, that what are they including, what they are saying about the guests. So yeah, these rules you have to go through with them before you move in to the new accommodation. So when you are waiting for your occupational health checkup in your hospital, you can go to your department. You can introduce yourself to your new colleagues, and then probably you can like walk around the hospital, see the departments, and then also they arrange some induction programs for new doctors. So different consultants from different departments come and discuss what common patients they have to handle, and how when do you need to admit them, when do you need to discharge them. So it's better for you if you attend this kind of inductions. It helps to get get to know the consultants and your colleagues, and how the system works. So it's really important. So yeah, that's it. So once you came here, and once you moved from your temporary accommodation to your permanent one, and you have gone to your hospital, you have been introduced to the your departmental colleagues, and then you have done your induction programs and occupational health check. So now you have to worry about what are you gonna eat. So they have different kind of super shops. So if even if you move in a furnished apartment, you still need to buy some things for you, like your pillow, your blankets, and your if you need anything else like table lamp, your crockeries, your toilet accessories, these things you still need to buy. So they have different kind of super shops. You can find these shops in every cities. So they have Wilko, they have Tesco, they have Morrisons, Aldi, Lidl, Asda. So these are different super shops which you will find in every city in London. So you can get everything there. I mean, food items, dry foods, like or ready-made cooked foods or something, Asian foods, and you can get your crockeries from there. You can get your washing stuff from there. So you need to go there, and probably when you buy these things for the first time, it will cost you like 300 to 400 pounds to buy the things at first time, because once you buy them you will probably don't need them in the next 5 or 6 months. So that's that. So starting from your accommodation in London, and then your transports, and then your accommodation in your workplace, and with temporary and permanent, it will cost from 1500 to 2000 pounds when you come here first. So sometimes what they do is, sometimes when you open the bank account, they give you some overdraft, which means it depends upon your salary. So depending upon your salary, sometimes they give you 2500 up to 2500 overdraft, which you can use even if you don't have any balance in your account, but you can use that money to buy things, and to maintain to maintain your fast 1 or 2 months of expense. Okay, so yeah, that's it. And then, okay, you have when you have once settled down in your work area, and you have like you have managed your accommodation and your food and stuff, and then you start working. So the first month is always the hardest one. I mean, you will find in every step that, oh, why am I here, what am I doing, I don't know, because the system here is quite different than our country. When you start working, so the you will have to your rota will be divided in three parts. So there are normal working day, and there are long days on call, and there are on call nights. Yeah. So a normal working day means you have to work from 8 till 5, and they are quite sensitive about their timing. It's not 8 means 7:55, 8 it doesn't mean 8:5 or something. So, and your long day on calls means that you have to work from 8 o'clock in the morning till 8:30 at night, depending upon your handover duration. Sometimes it's like 9 p.m. At night you finish. So that's like 12 and half hours. And your on call nights, you have to work from 8 o'clock at night from 8:30 next morning. So that's sorry. So that's the three kind of duties you will have to do here. So on your normal days, you just look after the patients that are already in the hospital, no new patients. So in your department you will have like 4 to 5 consultants, and you have to look after all their patients. So the patients that came, there will be a morning round. So there is first thing in the day, there is a handover meeting from 8 till 9, and then at 9 o'clock they start the ward round. So the ward round, depending upon the patient's numbers, the ward round will continue for 1 or 2 hours. So you will have to see all the patients, and you will have to your consultants will give jobs that, okay, this patient needs CT scan, this patient needs MRI scan, that patient needs to go to theater, that patient needs to be discharged. So these things you will have to note down that to do after round. That is pretty much like Bangladesh, there's no difference. And then on your on-call days you will have to receive new patients. So if you are working as an F1, so your on-calls are mainly ward based, you don't essentially need to go to emergency. But if you are an SHO, so you hold the on-call blip, which is a small device. So whenever some new patients, so the health system here is quite referral based. At first the patient goes to the GP, and then if GP thinks that they need to refer them to medicine or surgery patients, medicine or surgery doctors, so they will refer them to you. Or sometimes patient turn up in accident and emergency, and they might refer the patient to you. So you will have to take the calls from GP and from A&E doctors. You will have to, sometimes they refer patients with acute appendicitis, pancreatitis, cholecystitis, and sometimes they will just you can accept the referral, or if you think that this patient is not surgical, you can tell them that I'm not quite convinced that this patient needs any surgical intervention. So then they will sort out the patient further. So yeah, that's it. So then when the patient comes in A&E, you have to go and you have to take a full history, you have to examine, and you have to come up, you have to do the blood tests and stuff, and then you have to come up with a plan that what do you want to do with the patient, and then you have to escalate to your registrar. So your there will be a registrar with you on call, and then uh, they will also come and see the patient. So there are different systems, like you have to whatever you have seen the patient, the history, the examination findings, you have to write in the same systems. That's called clerking. So basically the SHO has to do all the clerking. Sometimes if it's really busy, sometimes the registrar or sometimes the on-call F1 comes and does the clerking as well. So it depends upon the situation. And then so yeah, you will have to then you will have to come up with a plan that the patient needs admission, or the patient can be discharged, or the patient needs any further investigation or something. So you will have to make a list of the patients you have seen throughout the day, and you have to hand over when you go home. So you have to hand over to the night team. So normally the 8 to 5 duties, you have to work 5 days a week except Saturday and Sunday. But if you do it's like 45 to 48 hours per week. So if you do on calls, which is 12 hours, then you will have to work 4 days a week. Or if you are doing nights, then 4 nights a week and then 3 days off. So uh, that's the usual rota, and you can take extra shifts, or if you are doing weekends, so you will have to do Monday, Tuesday, Wednesday, Thursday if you are working the week. And if you are doing the weekend, then you will do, for say, Monday, Tuesday, Wednesday you have done 8 to 5, and then Friday will Thursday you will be off, and then Friday, Saturday, Sunday you will be on call. So the on call, if I say about 7 days of the week, 4 days one doctor will be on call, and then the other 3 days another doctor will be on call. So you have to do 4 on calls at a row to maintain the continuity of patient care, so that you are knowing that what's been going on in on calls. So yeah, that's that. And so this kind of on calls you will have to do only once in a month. So in 4 weeks you will have to do 1 week on call, and the other 3 weeks you will be working normal 8 to 5 shifts. And if you are working weekend, then you will have to work 3 days that month only. So that's the usual that's the usual rota. And then about the pay, so it depends upon your level, which level are you working, how many experience do you have. So in F1 level, usually you can expect 2000 to 2500 pounds per month. And if you are working or maybe sometimes if depending upon your, because in foundation year they have F1, F2 and F3, and in core training they have CT1 and CT2. So and then they have ST. I'll come to that later. So if you are doing F1, the payment range will be 2000 to 2500 pounds per month. And if you are doing SHO post, so it will be somewhere like 3000 to 3500 pounds per month. So it will depend upon your experience. About the posts, I mean, sometimes people are really confused. I was also confused when I before I came here, that they have multiple terms like F1 and then F2 and then SHO, then clinical fellow, trust gate SHO, trust gate registrar. These terms are quite confusing, but when I came here, I saw that these terms are really not that important. This is just they have 4 levels of doctors. So one is F1, which is essentially interns, and then the SHO, and then the registrar, and then the consultant. So in so if I say about their training system, after graduation, their students go to F1 and then F2, then CT1, CT2, then ST3. So F1 is internship, and from F2 to CT2, as in F2, CT1, CT2, these 3 levels are SHO level, and then ST3. ST3 is registrar level. That's all I understood from this system. Like F1 is one level, which is intern, and then F2, CT1, CT2, those are basically HMO levels of our country. Those are SHOs, and then ST3 is the registrar. So for SHO, sometimes SHO they say junior clinical fellow, and for registrars they say senior clinical fellow. And if you are a trainee, then you are CT1 or CT2, and if you are like non-trainee, then they say that trust grade SHO or trust grade registrar. So trust grade SHO means non-trainee SHO, trust grade registrar means non-trainee registrars. That's what they mean about like by these terms. But the basic thing is there is only 3 levels: F1 and then SHO and then registrar. So that's the that's the pay range. And then so if I do some balance about the payment, and so first 1 or 2 months will be a little bit struggling, because there will be a whole new environment, whole new colleagues and whole new place to adjust in. And then you have to sometimes you have some financial struggles, cause you have to stay on the money you brought from your home. So it will be but once you settle down, then you will make a balance. So say if you are an SHO level, you will be earning from 3000 to 3500 per month. And say for if your house rent you pay 500, and then you don't have to buy, so for regular foods you don't have to buy more than 200 pounds per month. So if you just spend 30 to 40 pounds per week, that will be enough for like someone, one person. So if you spend 200 pounds on eating, so for first 6 months or 1 year, I would suggest that take your accommodation just as close as to the hospital as you can, because then you don't have to spend anything on the transport. So that means you are spending 500 and 200 700, and like if you just do some plus minus 200 or 300, so you are spending 1000 pounds per month. And then if you are earning 3000, that's still 2000 pounds. You like you are saving. I wouldn't say saving, because then you come up with a lot of more expenses. You need to do a lot of courses. So almost all the courses are like 600 to 700 pounds each. So if you do 1 or 2 courses per month, so you will be spending 1000 on courses every month again. And then it depends upon you, though. I mean, there is no definite. So if you just say that how much you need to spend for one person in UK for day-to-day living basis, like your accommodation and your food and your like basic transport, that will be not more than 1000. You can make it less, but not more than 1000. About residence, when you come here with the type 2 visa, you get a BRP card, which is a temporary residence permit. So biometric residence permit, which is valid for 1 year. So after 1 year, you have to renew your visa and get another card. So for doctors, it's if you stay here for 5 years, and then you get the permanent residence. So that goes the accommodation things. And then so that's basically that's the information needed to survive for first 1 year in UK. That how do you come, and then arranging your accommodation for first 1 year, and then arranging your daily foods and stuff, and daily expenses, and day-to-day work rota. So it takes you at least 1 year to get uh, accustomed to the system properly, be it in your workplace or in any other like social life and everything. So for 1 year, you just don't get any time to think about something else. But after 1 year, you may think about buying a car or buying a house. So I wouldn't really go to that extensive discussions right now. I mean, that's so far. Maybe I'll do some more lives in future, that how do you plan buying a car, and how do you plan buying a house or something. They have different kinds of systems here for them, but you can't really think about them in your first 1 or 2 years. So car maybe you can buy after 1 year if you want to, but for house. And also, I mean, in first 1 or 2 years, you don't know that exactly which city are you gonna settle in. So if you buy a house at some place, you might end up getting a new job somewhere else. So like it doesn't make a big difference. So after that, the work system here, what I was saying is, for especially for the junior doctors, the training things. So once you get a stable job, once you get your day-to-day life expenses settled, so now you have to think about your next step, which is essentially to get the training post. So to think about that, you have to if you plan from your home country, it becomes a lot easier for you. So as I said about the city and ST things, so the foundation year training is for 2 years, and then core training is for another 2 years, and then specialty training for, it depends upon the specialty. For general surgery it's 5 years, for some other specialties it may be 7 or 8 years or something. So if you foundation year, you really don't need to get into foundation year after coming here, because that's internship level and you have already done your internship back home. So you should aim for core training. But for core training, the problem is you can't if you for surgery, if you have more than 18 months, so which is 1.5 years experience in surgery, you can't apply for core training. So for the juniors who are interns or who are still final year students, I would say that if you are planning to come to UK, you need to start your planning as soon as possible, because after your internship, if you sit for MRCS, so it's like more than a year already, 1 year and 1.5 year. So by the time you already have 1.5 year experience in surgery. So what you can do is, either you can show only 6 months experience from general surgery from back home, or you can do some rotational job. I mean, 4 months in 6 months in general surgery, 6 months in trauma surgery, or if you are doing your training, you can so. And after coming here, if you take a job in general surgery, so you will be, before you apply for training, you will be working here for 1 year already. So it's better to keep your experience in general surgery 6 months from home. So 1 year here and 6 months from home, that makes 1.5 year, and then you can go for CT application. So for CT application, what you need to do or what not, I'm writing a article on that. Hopefully you will get it this week. So that's the thing for CT application. And for those who are a little bit more senior, then it's better to go for ST training, which is a bit more difficult than the core training. So I'd say for juniors, it's better to aim for core training. But if you are already working more than 18 months back home in general surgery, it's better for you to plan for specialty training. And also for specialty training, if you have more than 48 months of experience, which is 4 years, then you can't apply for ST3. That's another problem. So if you are planning to get into ST3, so you have to come before you complete 4 years of uh, experience in general surgery. And those who already have more than 4 years of experience, you can go with the CESR pathway. So yeah, that's that. And for the juniors, it's almost more than half an hour. I'm not gonna make it too long actually. So I'll just ignore them. These are my housemates. So the thing is, you have to come up with a very organized plan. I mean, you can, I would say that don't do anything blindly. That okay, everyone is doing that, so I'm gonna do that. Just don't do anything blindly. So if you have to come up with a organized plan, you have to. So if you are in final year, you have to make your decision now, that if you are going for surgery or if you are going for medicine or something. So you have so that you get enough time to do what you want. So as I said, if you are just doing internship, then probably go start preparing for MRCS Part A now, and then after internship, if you just complete your MRCS Part A, and then for MRCS Part B you don't essentially need any training. So it's better as soon as you can give. But still I would recommend doing 6 months of training, because you need the clinical confidence. Yeah, MRCS Part B is more like a clinical exam, so you need to be confident about your clinical skills, your procedures, your examination and history. So hopefully we are planning on it. Hopefully we'll be able to do that. So in after Eid we are planning to start an online course on MRCS, because there are a lot of students outside Dhaka which is doing classes in coaching every week is not so convenient for them. So we are planning to run some online courses instead on MRCS Part A and MRCS Part B, and eventually we might just start some for the OET and IELTS as well. It depends upon the how many students respond to this initiative. So Genesis is already running MRCS Part A. We did 1 or 2 courses on MRCS Part B. Most of the students of MRCS Part B have to go to India, which is a bit difficult at this stage. And so we are planning to run some online courses on MRCS Part B to help with your practice and stuff. So sorry. Sorry. So hopefully we will be able to do it after Eid. Hopefully everything stays under control till then. So I have been receiving a lot of texts from juniors, especially students, third year, fourth year students, and final year students and interns, that what we should do, what are the procedures we should follow now as we are students. So I would say that, especially who are studying in third year, so this is your first this is where you first starting your clinical exposure. So you are seeing patients, you are going to the wards, and you are and everything. So I would highly recommend that make your own format of history taking. So when a patient comes, we go step by step. We take a brief history, and then we do some clinical examination, and then we arrange some investigation for them. So when you first time see a patient, take a full history, and just forget that you have any consultants or any registrars or any mid-level seniors. Just forget that. Just think about that you are the only doctor for this patient in the world. So take a history and do examinations and make your own provisional diagnosis. What do you think this patient is? What do you think is going on with this patient? Is this patient, why does this patient have abdominal pain? Why is this post-op patient complaining chest pain? Why is this patient having having change in their bowel habit and losing weight for last 3 to 4 months? So ask yourself these questions and come up with a plan, make your own diagnosis, and try to think about some differentials, and then try to make a plan which investigation you should do and how should you manage the patient. Don't look at your seniors' notes, just do your own planning and then match them with your seniors, and then see that what are they doing for the patient. That way you will actively learn how to that way you will be able to judge your accuracy of clinical judgment. So this is one thing you should do when you are in your third year or fourth year, or you have just started your clinical placement. And then when another thing is, be a good reader and a writer. Read I'd not say yeah, I know that you have to read textbooks and all for passing exams, but also make yourself acknowledged to the current guidelines, treatment guidelines. Or even if you can't do that, just read different websites. So if you need to come up a plan what you should do in future, you need to do different websites, you need to see how different systems work, and then you have to practice public speaking. You have to make yourself comfortable with public speaking. You have to be able to speak out for yourself. When doesn't matter if it's a word round, or if it's your classmates, or if it's your teachers. You have to speak fluently what do you think about this patient, or and then try to do some writing, as if anything. Try to do some organized writing. I mean, these things sound a bit silly when I say that, and if you are a fourth year medical student, you will not get it. Why am I saying this? Because when I was in fourth year, I would never get why do I need to do writing, why do I need to practice public speaking. Because when you are a postgraduate student, even if it's in Bangladesh, even if it's in London, even if it's in America, so you have to attend different kind of meetings, different kind of clinical meetings, audit meetings about patient management, and maybe some MDT meetings. So you have to present your case. So if you have seen a difficult case, and if you have managed that, you should be able to make a report on that, and you should be able to present that case in front of your colleagues, so that the others can learn. And also try to teach your juniors. If you are a final year medical student, just try to gather some third year medical students and teach them something, just anything, just teach them the steps of history taking. What are the questions you need to ask if a patient is coming to you and complaining abdominal pain, then what are the questions you need to ask to make a diagnosis that why he or she is having the abdominal pain. So teach them. And so if you get a patient who is breathless, so he can't breathe, what is the first step you need to do? You need to speak to the patient, you need to check the saturation, and that's like ABCD. So just the final year students, the interns can teach these things to the fifth year students, the fifth year students can teach these things to third year students. So if you teach, then you learn even more than when you read. So that's a. And also, I mean, I don't mean to offend anyone, please don't get it the other way. I'm just speaking because I know how I was when I was a third year or fourth year medical student. So I was full of self doubt, and I can see all the juniors who has been texting me or who has been speaking to me. I can see 90% of them full of self doubt, that Abu, can I do this, can I, is it possible for me to go to UK, is it possible for me to work in surgery? I just ask, why not? Why do you think that you can't do that? I have, just trust me, I've seen doctors here, I've seen doctors in my country. The juniors in our country, they are they are no less talented or no less hardworking than doctors in anywhere in the world. It's just you need to believe in yourself. You just need to believe in what you do. So as junior doctors, you are like, you should be full of energy. You should be um, you know, because when you are a student, when you are an intern, you are allowed to make mistakes. That's the strongest thing in like that's the strongest part of you, because when you are a consultant, you are not allowed to do a mistake. That's what I'm saying, because if you are an intern and if you are making mistake in patient management, then you have like 3 to 4 other seniors to help you or to correct you. But when you are a consultant, but when you are a registrar, when you are on your own in the theater or in the emergency, if you make a mistake, that can affect the patient's life. But now your mistake cannot kill a patient. So do not be afraid to speak up. Do not be afraid to make a wrong plan for the patient, because when you come up with a wrong plan and when you see that the seniors are doing it in a different way, that's the only time you will realize that, oh, what is your, I mean, where should you correct your mistake. So just do that. And yeah, another thing for students, what I've said, that do not be afraid to dream anything. You can be anywhere in the world, you can do anything in the world. If you want to stay in your country, if you want to go abroad, if you want to go anywhere, if you want to go in any specialty, you can do it. I mean, there's no way that you will not be able to do that. It just uh, you just maybe need to work hard. If I am now working here in UK, it's just because I have worked for it for 2 years. It doesn't mean that I am any more talented or any more hardworking than any of you. So that's the only thing you should come up with. And for the juniors, the only thing I say again and again, that please make decisions about patients. Only when you make decisions, you will be able to find out your mistakes, and you will be able to find out the different ways that we think when we manage a patient. And then yeah, read different, go through different websites. Go, if you are not sure yet that you want to go in medicine or in surgery or in gynecology, in pediatrics, whichever subject you choose, just go through the websites and go try to understand that what you need to do to be in that specialty. Well, I think that I've got left 5 minutes more. Do you have any more questions that I can? If you want to ask any questions, you can write in the comment section now. We have got 5 to 10 minutes more. I don't mind answering any questions because I think I have covered the topics I wanted to cover. I have covered the accommodation things, the new job, new place, where to buy foods, and what to plan for first 1 year, and what to do as a student back home. Is there anything else that I can add to this discussion? Uh, what are the requirements for CT training in orthopedic surgery? Well, so for CT training, there is the CT training is not in orthopedic surgery or in general surgery or in neurosurgery. CT training means co-training in surgery. So you will be rotated in different specialties. You will get a 4 months rotation in 6 specialties. So if you do CT training for 2 years, you will be 4 months in general surgery, 4 months in orthopedic, 4 months in plastic. It's just you will be rotating so that you can learn the basic management of all the patients. And if you are asking about specialty training in orthopedic surgery, you can just search in the Google that ST orthopedic surgery requirements 2020. So the requirements will just come up. Okay, about the vacations. Well, that's a good point actually. So they have annual leaves, and then they have study leaves, and then they have sick leaves. Annual leaves, you get 28 days per year. So the system is you have to take half of them in first 6 months and half of them in last 6 months. So if you have 28 days of annual leave, you will have to take the 14 days in your first 6 months. So the ones who come from abroad, you can take 2 weeks of annual leave, and then you can go to visit your homeland if you want. And then about the study leave, if you attend any conference, any academic seminar, any courses, so if you go there, you can just apply for the study leave. I think for non-trainees they have like 8 to 10 study leaves per year, and sick leaves I think you can take highest up to 15 to 20 days per year. um, will training and job experience after internship here in Bangladesh will be granted there? Is okay. Training and job experience, yeah. So the thing is, when you apply for GMC registration or when you apply for job, you have to show everything you have done after your internship. Like I completed my internship in 2015 and I moved in UK in 2019. So from 2015, after the day I completed my internship till I came here, I had to submit all the experience certificates from home. And will they be granted? It depends upon, like, if you are working in general surgery and you have teaching experience for 4 years, or you have working in medicine, so that will definitely not be granted. But if you have worked in general surgery for 2 years, and definitely they will grant it here when you join. So if you have 2 to 3 years of experience back home in general surgery, you can apply for a register post directly. Any other question? MRCS, MRCP, training post, like training in UK is if you have. So the MRCS thing is, another this question that whether to do PLAB or MRCS. If you give PLAB, you will get a job in SHO post in UK. If you give MRCS, you will get an SHO post in UK as well. So the thing is, why MRCS or why PLAB or why MRCP? So after coming here, you will have to make a plan that either you want to go to surgical training, or you want to go to medicine training, or you want to go to GP training as well. So UK healthcare system is a lot based on GP system. As I already said, that the patients at first go to the GP, and then the GP refer them to the specialist doctors. So if you are planning to be a GP here, you can give PLAB and you can come here and you can apply for GP training. But if you are if you are planning to get into surgical training, so before application of core training, you have to complete your MRCS Part A, and before completion of ST training, you have to complete your MRCS Part B. So if you just complete MRCS Part B from back home, then it makes these things a lot easier for you. And if you are if you gave PLAB in your country and then you came here and then you are planning to apply for surgical training post, so before you apply for CT training, you will have to give MRCS Part A. That's the thing. Well, about racism, the I can't tell about every place. I have worked in only one hospital in UK. I can't say it that there is absolutely no racism or something. But what's fortunate for us is NHS is a lot based on Bangladeshi, Indian, and Pakistani doctors. So if I make a ratio in 100 doctors, there will be 70 doctors will be from outside, and 30 doctors will be here from London, who graduated in London. So it's like it's not most of the we have 8 consultants, so 2 of them are British, and the other 6 are from India or Pakistan or other Middle East or other places. So it's really not convenient for them to do any racism towards us. That's what I got it, but I can't say that it doesn't happen anywhere, because I have not worked in every hospital in UK. But from where I see, I mean, doing any racism towards the other country doctors is not like convenient to them. But sometimes when you are working as a non-trainee post, you can feel like the trainees are preferred a bit. Which brings me to another important topic actually I wanted to discuss, that the surgical opportunities you get here when you are working as an junior doctor. So if the thing is, I'm not advertising MRCS here. Okay, I'm not advertising any that okay, this is so good, you have to do this, you have to do that. I am here just to show you the real picture, what you can expect when you come to this professional life. So as if you are planning to work in surgery, you have to make up your mind that you will be competing with other people. So as a junior doctor, if you are interested in surgery, when you are working here, you have to go to the theater, you have to show the consultants that you are interested in surgery, you want to do it, and you have to scrub in. So they will let you scrub in. It's not that they will not let you in the operation theater, they will not let you, but before giving the scalpel on your hand, they will judge you at your every step. So you have to show that you are competent enough to do the surgeries. So when I go to the theater, they let me do any kind of abscess, or in when we do laparoscopic appendicectomy, they let me do the ports, and then they let me do the loops in the on the appendix, and then the closure, and then when we do hernias, they let me do sometimes they let me do the incision and some dissection, and maybe the fixation of the mesh, and then the abdominal wall closure. So so it depends upon you, and at first it will take 5 to 6 months to you know, to get your face to make your face familiar to the consultants. After 6 months they will start to remember your face, that okay, this junior doctor is coming to the theaters frequently and scrubbing in. So when you are scrubbing in for the 8th or 10th time with the same consultant, he will probably let you do some staplers on the gut, and some abdominal wall closure, or some dissection, some incision. But you have to show that you are interested and you are competent. There is no way that you will come in the first day, and then the first day they will give you the scalpel, and then they will say that okay, go your surgery. You cannot like expect it like that. You cannot expect it anywhere. So the thing is, you have to earn that trust, you have to earn that place. So for first 3 to 4 months you will not get a lot of them, but after that, when the consultants start to rely upon you, probably they will end up giving you some bits. And then after working 1 or 1.5 year, when you become the registrar, then you get to do the appendicectomy and hernias by yourself, and you get to do the hemicolectomies and laparotomies with your consultant, and maybe you will do the anastomosis, maybe you will do some dissection, and that's it. So okay, it's already more than 3:30 now. I think that I will not make it any longer. Thank you so much who joined me in this live session today, and if anything is not clear, just make some comment. And the last thing I will again and again say to my juniors back home: do not ever doubt yourself. You can do whatever you want to do, you just have to work for it, you just have to be very dedicated, because it's a lot of struggles and hard work. So you will have to prepare yourself to do that. But it's not impossible. You can do it if you are really dedicated towards your career. And thank you so much for joining. Thank you so much, Genesis, and thank you, Tarek. Thank you, Elite Medical Forum. And please keep an eye on the posts in the group, because hopefully we are starting the online course after Eid. So probably you will. I am making some demonstrative videos on MRCS Part B OSCE stations here in my hospital. So hopefully we will start you maybe that will help you having some ideas on how does it work in the real examination hall. So just keep an eye and keep me in your prayer, and work hard for whatever you are dreaming for. Soyod Najin Morshed. Oh, I miss Charu's canteen too. And I miss Bangladesh. I miss you all. Bye bye.